Imagine finding yourself in a helpless situation for something out of your control. Wouldn't you want your treatment preferences to be known? A Psychiatric Advance Directive is a document that will make it easy to share information about your preferred treatment in the event of a mental health crisis.
I think psychiatric advance directives are a really great tool for peers to be in control of their treatment options when they go into crisis.
As a result of me being a part of the mental health system and at first not having a psychiatric advance directive, I believe my voice wasn't, heard because they just didn't have the tools.
Even if you are never hospitalized or jailed because of your illness, ever, I would still encourage somebody to fill this form out, to fill out a psychiatric advance directive, because it reframes the priority, which is to maintain who you are.
It means that your preferences will give guidance on how to best interact with you, and includes basic but important things such as which medications work best and which might not work well for you.
You know what to do when you have the flu. You know what to do when you sprain your ankle. I know what to do when I'm having a crisis moment, because this is my life and this is just another thing for me.
A Psychiatric Advance Directive will help with de-escalation in times of stress. It allows your voice to be the guide towards the best possible outcome.
I think that first responders, emergency room workers, they're very stressed. So just seeing that effort for communication is really helpful and encouraging because it makes their job a bit easier.
If we had an advance directive prior to all of this, prior to the crisis, then we'd be able to follow what they need, because they know what they need and they know what works for them.
For folks to know what my health conditions are, what my mental health conditions are, how I would like to interact, how I would like law enforcement to interact or de-escalate me in a crisis situations.
Having timely access to information about you and your preferences help us better understand how to achieve better outcomes for you and everyone involved in the time of crisis.
But it's also recognizing that I have insight into myself that a clinician, a doctor, a staff will not always or rarely do have.
The new digital Psychiatric Advance Directive platform will be available online. Whether on your own or with the help of a trusted individual, it can be easily set up by answering some questions. You'll be asked such things as how best to communicate with you in a crisis. You can choose which questions you want to answer and what treatment preferences you would like to provide. If you don't know exactly what will help you, you can work with a facilitator, such as a peer support specialist, a behavioral health worker with lived experience.
The interface is very easy. It's compatible with all your phones.
We get to have a little profile picture, and it looks really kind of like social media, and you can see a person smiling and being just a normal person who'd be walking down the street.
When you fill out an advance directive and you are put in a situation where that psychiatric advance directive needs to be implemented, the first thing the people who arrive on the scene, who are supposed to be there to help you, to hospitalize you if necessary, is they see an image of you that is more representative of your own unique and wonderful personality.
Changing preferences will be easy to do. Because it will be stored electronically, updates take effect immediately. Your Psychiatric Advance Directive is a private document which will only be shared under circumstances which you get to choose.
I would say having a Psychiatric Advance Directive, it makes me feel empowered and if a crisis comes up for me, I'm prepared.
Don't make a decision about my treatment, my mental health, my wellness without me, because we know that we know ourselves best. Nothing about us without us. Nothing about me without me.
Every single time a person has been successful and has overcome a very difficult thing, it had to start with one step. And I believe that the Psychiatric Advance Directive will be that first step for so many people. Let's get started.
For more information about psychiatric advance directives, visit our website, www.padsca.org.